There's frequent discussions about the role that overactive pelvic floor muscles play in pelvic pain and how this might be the cause for pelvic pain. But what does the research really tell us about overactive pelvic floor muscles in men with chronic pelvic pain? There's no gold standard for evaluating pelvic floor muscle tone, meaning that when somebody tells you that your pelvic muscles are super tight, they're just basing this off of their own subjective feelings. There's a lack in precision sensitivity assessing pelvic muscle tension. There's also no valid scale to score level of tightness because we don't have any normative values to compare this to. We also don't have a scale that measures relaxation, and we don't have any normative values to compare that to. Surface EMG, electromyography, like biofeedback, uses an internal or external sensor to tell us information about muscle activity. But it doesn't tell us whether or not a particular reading is problematic or normal. There's also no diagnostic cutoff score to tell us what normal is or what it isn't. In a 2022 study, researchers compared the pelvic floor muscle resting activity of 90 men with chronic pelvic pain to men who did not have pelvic pain. They used a rectal surface EMG electrode to assess muscle activity. They assessed two conditions. Condition 1 was the rest only for 10 minutes, where participants were told to lie down, not to move, and allow the researchers to record resting muscle activity for 10 minutes. Condition 2 was the rest in between contractions. Participants were told to contract their muscles 30 times. They were told to hold that contraction for 3 seconds and to rest for 5 seconds. During the rest phase, researchers measured the resting muscle activity after a pelvic floor contraction. The research showed that there was variability in resting pelvic floor muscle activity between both groups, men with pelvic pain and those without. The research also showed that those without pelvic pain were able to return their resting muscle activity back to their baseline after contracting their pelvic muscles. For the group with pelvic pain, it was a little bit more difficult to bring the muscle activity back down to their resting baseline. This difference was more noticeable in those who reported pain with ejaculation, pain at the tip of the penis, and pain with urination. It's important to note that even though the pelvic pain group had diminished ability to go back to baseline after contraction, their muscle activity overall was lower than the control group, than the men who didn't have pelvic pain. This data doesn't tell us that this difference is problematic or the cause for pelvic pain, especially when compared to a control group where their resting pelvic muscle activity was still higher than that of the group with pelvic pain. Instead, this research reflects that men with chronic pelvic pain and the difficulty to bring their muscles back to baseline after contraction might have to do more with a protective mechanism that is driven by central nervous system activity, the brain and spinal cord, dictating the activity of these muscles. So strategies to help retrain these protective responses might be more helpful than just focusing on relaxing your pelvic floor muscles. Thanks so much for watching. If you found this video helpful, please subscribe and hit the like button below. This will help other guys in your situation also find these resources sooner than later. If you're a penis owner who's currently struggling with pelvic pain, you're not alone. Check out the Men's DIY Pelvic Pain Relief Program. The link is in the description below.